I think if the new grad has the right mindset that they're there to be a full-fledged ER nurse and they want to go in all the way and do everything they can to be the best ER nurse, I think they'll succeed just fine. But I think if they come into it with the wrong attitude, and if the health system doesn't do a great job of supporting a new grad, then it can be very harmful for the profession.
How can we potentiate and sharpen the skills of emergency nursing to maximize the impact of this crucial nursing specialty? Let's talk all about it with Michael Dexter, the Director of Professional Development at the Board of Certification for Emergency Nursing, right here in episode 495 of The Nurse Keith Show. Hey there, this is Nurse Keith. This podcast is always about you and your personal professional development, your nursing career, and the healthcare system writ large. And I'm here to share education, ideas, and informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, entrepreneurship, medicine, and beyond. I love having you along for the ride, and I really want to thank you from the bottom of my nurse podcaster's heart for being part of the growing Nurse Keith Nation as we continue our countdown to episode 500. And if you'd like to help other people find the show, you can leave a rating and review over on Apple Podcasts, or just share the show with anyone who you feel might get something out of it or enjoy it. And if you want to become a patron, head over to patreon.com, patreon.com/Nurse Keith. And no matter how you're interacting with the show, thank you so much. The show notes are always at nursekeith.com in the drop-down menu labeled podcasts. And of course, the show notes can be accessed via any podcasting app where you find yourself listening. And as I said, we're here today with Michael Dexter. He is the Director of Professional Development at the Board of Certification for Emergency Nursing. And Michael, it's great to have you on the show and connect with you again. And my first question is this: what's a way or several ways that emergency nursing has had to do some pivoting in recent years to keep pace with the changes in the larger healthcare landscape out there?
Well, yeah, absolutely. Thank you for having me on. And it's a very large question that we could talk about for quite a while. And so to pare it down into some smaller notes, I would say is that healthcare as a whole is constantly evolving. And there are things that we talk about today that we didn't talk about at all 10, 15 years ago. Different therapies, different ways that patients with chronic long-term conditions are cared for at home now. And occasionally when those individuals have issues, they come into the ER because it's their really only place to find care. So you have complexities of patient care. You have changes in the way that healthcare works as a whole, legislative changes that have happened in the last 10, 15 years. You also have different ways that nurses are being trained and precepted and a shift that's happened. And so a lot that's happened in healthcare in general. I would say looking at emergency departments specifically, there are more and more freestanding emergency departments out there. There are also more health clinics. There's more urgent care settings. And so a lot has been done to try to offset the burden of a heavy patient load in emergency departments. And in a way that has helped in some regards. In other regards, it means that there's more opportunity for sicker people to be in the ED. So the acuity levels, at least in my perspective and with the different ones that I have worked with and talked with, acuity levels seem to be higher over the last few years. So emergency nurses are now taking care of quite a few patients that often have higher acuity levels. They're sicker patients out there. There are more and more people coming to the ED as a secondary step. So maybe they went to their primary doctor first, they went to an urgent care first. They've already been evaluated once by a care provider, and now the ED is the second place that they're coming. And so emergency nurses have to really look at that population as a challenging population. And it's a lot of patients that we have to deal with now that are very medically complex. There's a lot of pivoting on your feet from moment to moment with, those different ones, whether it's a young child, whether it's an older adult, anything in between in any variety of conditions. And so an ER nurse traditionally, for as long as emergency rooms have been a thing, ER nurses have to be adept at many, many multiple conditions out there and caring for patients in all walks of life. However, like I said, as we continue with more medically complex patients in the community, more technologies there, more of these sick patients, I think ER nurses are seeing that there's more and more of a blending of that critical care need that they have, as well as being a critical care emergency nurse that can think on their feet, pivot quickly, and work with a variety of teammates that may be shifting a lot. We've seen the whole healthcare workforce shift quite a bit over the last few years. And so it's a different dynamic. It's a different environment. I've been an emergency nurse now for over 17 years. I've worked in emergency care for close to 20 years, and it's definitely changed over the last few years. And it takes a special type of person to be an emergency nurse. But thankfully, there's a lot of opportunity out there to succeed.
Right. And I'm curious from your perspective, there's the critical aspect, and then there's so many people who seem to come to the emergency room for primary care because they don't have any primary care, or they've been to urgent care and they can't get what they need. How much of emergency nursing do you feel like also involves psychiatric and psychological and psycho-emotional intervention? Is that a really huge part of emergency nursing?
Yeah, the mental health aspect, is that what you're referring to? Yeah.
Yeah.
So the mental health aspect of care has really, really grown over the last, I would say, 10 years. There's a lot of states that have had fewer inpatient beds for patients that are suffering from mental health conditions. However, the total volume has either grown or stayed at a level that makes it very difficult for these patients to find inpatient care. And so the ER becomes a holding place. And so on any given day, most EDs in moderate to large sized cities are holding patients with mental health emergencies just waiting on placement. It is a huge, huge concern all over the United States. I've talked with nurses in some states that have held patients for weeks on end. Many times it's common to hold a patient for several days that's suffering a mental health emergency in an emergency setting. And it's, as anybody knows that's been in an ED, not even a nurse, but just a visitor, if you've been in an ED, it's a very loud environment. It's often a very chaotic environment. And it's not the environment that's conducive for a calming atmosphere that a lot of those individuals need. It's not an environment that provides that kind of care that a lot of them need, because we focus on emergent conditions. And a lot of times these individuals need medication regimens that often take days to weeks to fully meet their individual needs. And so it's not the best place for them to be by any means, but there's not a lot of other options, unfortunately. And so often these individuals are left in emergency rooms. So an ED nurse, one of the essential competencies now of being an ED nurse is being able to care for them, being able to advocate for them, being able to connect with them regardless of what their condition is, and being able to do that in a compassionate and supportive way.
Right. And that's so tough when you're busy and you've got critical patients, but when someone's in a psychiatric crisis and they need your attention as well, I'm sure ER nurses felt they can feel like they're being pulled in so many directions, which they are all the time anyway. And I'm curious, you're the director of professional development at BCEN, the board of certification for emergency nursing. And obviously you all are focused on education and advocacy, and we'll get into a lot of those details throughout the course of our conversation. But what do you feel like are the current the places or the aspects of emergency nursing where you feel like the nurses who you all support out there in the country, like, what do they need the most? Like, if they reach out to you or you talk to ER nurses, what are they saying they want? And what are they looking for when it comes to either improving their skills or getting whatever support they need to do their job?
Yeah, that's a good question. It's also another tough question.
Mm-hmm.
And I feel like the general sense that I get, I do still work clinically, and so it gives me a good opportunity to be at the bedside, caring for patients, working with these other nurses. But of course, I have a much more holistic view since I collaborate with nurses all around the country as well. And there has been, it's nothing new, but there has been a sense of a disconnect for a while between bedside nurses and management and upper hospital leadership. And that disconnect, of course, varies from institution to institution. But it feels like, I think when you talk to nurses about ethics and morals and the things that they really feel passionate about, it often seems to boil down to the fact that we're very good at getting patients in. We're very good at triage. We're very good at isolating severely sick individuals and treating them rapidly. We're not always that great about getting them out. And sometimes we feel like that's beyond our control. It's a health system issue, it's a bed placement issue, it's a manager issue. And it's easy to point fingers. And I'm not saying that I have all the solutions for that, but I think that that's probably one of the biggest things is we try, and through my job at BCEN, I try to really support education that they need to feel comfortable, to feel confident when they're caring for patients. And we have tried to do that. I know there's organizations out there that have tried to really work on educating emergency nurses, helping with collaboration, bouncing ideas off of each other. But I think that there's still, despite what a lot of us have done, I think there's still a lot of frustration around the fact that when it gets out of our control, when it's beyond the education I've received or the skill set that I have, and I'm now dependent on somebody else to give me a room assignment or to accept a transfer or those things, that's when nurses, I sense, get really conflicted because you have a patient that's very critically ill. Let's say they're a ventilated patient on multiple drips, and now you're caring for them and you're caring for somebody in a mental health crisis and you're caring for somebody else that's short of breath and needing multiple breathing treatments. And you really know that the best place for this individual on multiple drips and on the ventilator is in the ICU, but there's no ICU bed. And so now you're becoming the ICU nurse and you're still trying to manage ED patients, and you don't have the skill set to really be that inpatient ICU nurse. And so that's where I think that there's still a hard part of emergency nursing in just trying to do what we know, do what we can to provide good care, but also how do we get that patient to where they truly need to be? And that's the hard part. But in terms of BCEN and in the support we give, because those things are beyond our control and they're often beyond a lot of people's control, the focus that we really can provide is that ED setting and that individual setting. And so we try to make sure that a lot of the education we provide, whether it's in person, webinars, CE courses, those things, is really tailored to honing those emergency department skills so that they can provide the best triage from the door and in the room, those skills that are needed. And then getting beyond that, that's still a tough thing to do.
Yeah, it is tough. And, I'm curious from your perspective because of your focus on education. I wonder about your opinion in terms of new grads coming directly into the ER, because from what you say and what I understand and what I hear from nurses in the ED, that, the complexity is so intense, and the like just what you're describing in terms of having a patient on multiple drips in a vent who should be in an ICU, and then you have someone in a psychiatric crisis, and then you've got, whatever else comes through the door, right? And you're obligated to take care of whoever comes in the door. So when new grads come in, I do hear about emergency residencies, emergency nursing residencies, which to me sounds like a fairly, well, maybe relatively sane way for a new grad to come into the ER. But how do you feel about that process of bringing new grads in to this type of milieu when they're just fresh out of school? How does that work? And do you think it's generally a successful transition?
I don't think it's valuable to always put every person in the same box.
Mm-hmm.
And I think that there are new grads that are extremely successful in the ER. I think there are very seasoned nurses that will transfer to the ED that do not do well at all. I've seen both. When I started, I worked full time for an ambulance service for 2 years before I became a nurse. And at the time that I became a nurse, it was pretty hard to get into the ER. And they gave me an opportunity based on my EMS background. And there weren't a lot of new grads when I first started. I was in the ER for a couple of years full time, and then I transitioned to working in a cardiovascular area for a while, and I just worked PRN in the ER. And I always stayed PRN in the ER. I went back to being full time in the ER several years later. But the insight that it gave me to step away from the doors of the ER every day and see the patient in a more holistic view, to be able to see patients that are not suffering an emergent condition, but maybe they came in for an outpatient procedure and had to be admitted, or maybe they did have a heart attack. And that variance, it gave me a very different perspective when I went back to the ER full time and I was caring for these patients and then working with nurses that had never been anywhere other than the ER. And they didn't understand that you certain very caustic drips that you're giving through a very small diameter IV in the hand. When you're in the ER, you don't think much about it because you're just seeing that immediate result that, hey, this is helping their blood pressure or whatever. You don't see that extravasation that's happening a few days later. You don't see the skincare that they had to go through because of those multiple missed IV attempts because you were just randomly stabbing at their arm. You don't see these kind of things. And so it gives you a very different perspective. So going back to your question, I do think emergency nurse residency programs are helpful. I think anything you can do to set up an individual for success is great. And when I was an ER educator and assistant manager, I used to tell people all the time, if the ER is not the place for you, I understand. But while you're here, I want to give you every tool you can possibly get to succeed. So that if you do decide later on this isn't for you, at least you can say that I was supported and I had the tools I needed. It just wasn't for me. But if it is the place for you, then I've already given you a great start because you have everything you need to succeed. And so I think if the institution supports the new grad in the right way, it works well. I think if the new grad has the right mindset that they're there to be a full-fledged ER nurse and they want to go in all the way and do everything they can to be the best ER nurse, I think they'll succeed just fine. But I think if they come into it with the wrong attitude, and if the health system doesn't do a great job of supporting a new grad, then it can be very harmful for the profession.
That is a very measured response that makes so much sense to me. And I think you're right that mindset has a lot to do with it. But I think it is very organization dependent, and maybe beyond organization dependent, it's department dependent, because you might have a department where you have quite a few seasoned people who are totally on board with making sure the new grad gets everything they need, but then you might have some jaded types who don't want to give the new grad the time of day and maybe even do their best to make their lives not so fun. So we can be set up for success or not, but we obviously, the staffing needs are there. So I can understand why new grads are needed. And I'm a big supporter of residencies in general. I just think they're a good idea. And we could go down this rabbit hole where I think every new nurse should be in a residency of some kind, and they shouldn't be such highly competitive things that the precious few get into. But that's a whole nother conversation. But before we go to the break, I just wanted to ask you, in terms of the environment out there that you see, and I know you have your finger on the pulse of what's going on. Do you feel encouraged that there are some changes happening for the better, and that the world of emergency nursing through, certification and education and advocacy, do you feel like things are getting tighter and stronger and kind of more cohesive in your specialty?
Yeah, a lot of times when people talk about emergency nursing, they immediately want to go back to the COVID pandemic and all
Mm-hmm.
these changes that happened. And there certainly was some negative with that. I think what it also did was shine a light on some of the needs. And there's a lot of places that have really tried to fill in those needs. And so there's many systems now that are doing things to better support the mental health and the wellness of the nurse as an individual. There are places that are really working hard to improve the door in, door out times of patients in the ED, make it a smoother process, improve the technology of the EDs, really step up that. There's also more of a light being shown on leadership. And for a while, there were some leadership options out there, but I think over the last few years, I've seen a lot of leadership opportunities for new managers or ER department managers and department heads and things. And so I think that there has certainly been challenges over the years since long before I was an ER nurse that have happened. I think that's every industry, though. And I think it's a little bit silly to think that we're a unique industry that doesn't face challenges. But I do feel like there's a lot of stuff that has come down and is continuing to happen currently to really support the nurse manager, the charge nurse, and provide better education, better opportunities, better managerial styles. And there's a lot of opportunities for patients too. Patients are coming in more informed. There's a lot of options for them to come in. So there's a lot we can learn from them that we couldn't learn from them years ago prior to the internet or prior to some of these available resources. So I've had patients come in before with a whole list of things that they think that they have. And, you just kind of like, okay, well, that's interesting. But with that sense, I've also had people come in that are very well informed and they say, I took this medication. I believe I'm having this interaction. I have this specific chromosomal deformity. And they're very well informed and they teach me so much. And so I think between the opportunities for nurses to grow as a whole and the opportunities for everyone to really learn a lot more through available education. We're in a continuously growing place that really provides a blossoming environment for people that want to blossom and want to grow.
That's really encouraging to hear. And when we come back to the break, I want to dig more into what BCEN is up to. I want to talk about the different certifications you all offer, of which I believe there are half a dozen, and some other questions I have for you about just the work you do and your vision for the education and support of emergency nurses. So hang in there and we'll be right back for the second half of episode 495 of the Nurse Keith Show with Michael Dexter, the Director of Professional Development at the Board of Certification for Emergency Nursing. Are you looking for a fascinating and novel way to empower and elevate your career? My wife, Shada McKenzie, is a gifted traditional astrologer and reader of the tarot with clients around the world, and she offers my listeners a 10% discount on their first consultation. Shada's approach to astrology emphasizes the integration of both modern and traditional techniques as they've been practiced for over 2,000 years, and she brings her sensitivity, life experience, and wisdom to every consult. Shada's work can reveal deep-seated patterns and unlock your potential to live a more meaningful personal and professional life. I and many of my clients have benefited greatly from Shada's mastery of these ancient tools, and if astrology is aligned with your personal belief system, I encourage you to consider reaching out to her at thecircleandthedot.com or email her at Shada, S-H-A-D-A, at thecircleandthedot.com. Remember to mention the Nurse Keith Show for 10% off your first consultation, and thank you. welcome back to the second half of the episode. We're here again with friend of the pod and my new friend and colleague, Michael Dexter. He's the Director of Professional Development at the Board of Certification for Emergency Nursing, also known as BCEN. And Michael, we were talking about education and advocacy and the changes in the healthcare environment and, gosh, what ER nurses go through in terms of the multiplicity of types of patients they have to deal with, often all at the same time, coming at them from a million different directions. And my hat's off to them. It's not something I ever chose to do or would choose to do. But I'm curious, in terms of certification, I know that's a really important thing to BCEN and to you. And I understand that, certification is part of how we demonstrate mastery. And I think it can help in terms of finding jobs, because if you have a certified nurse and a non-certified nurse, that can often be possibly the thing that makes an employer take notice of you. And I'm curious about your view on certification vis-a-vis emergency nursing. And then I want to hear about the 6 different certifications that BCEN, advocates for and administers. So could you give us a little, give us Michael's, 2 cents about certification?
I think certification is extremely important. And it's not just because I work for a certification company. Mm-hmm. I held multiple certifications before I joined BCEN. And you're right, it does give you a leg up in an interview process or in a job search and those things. But I just to quickly share a story with you about my own process. I was a nurse for roughly 6 or 7 years and had no desire to become certified, didn't really think anything about it. And I worked with nurses that had their certifications, and everyone I worked with was a great nurse. I just didn't really see the value for myself. And it wasn't until sitting down with a nurse that I really respected a lot, and he explained to me that certification opened a lot of doors for him. And if I would become certified, I'd realize that it would change my career a lot and open a lot of doors for me. And I didn't understand at the time how accurate that was. I was just thinking about possibly getting into flight nursing and what do I need to do to become a flight nurse. And so in that conversation, I started being encouraged to study for my first certification. And that really opened my eyes to the fact that I've been doing this now 6 or 7 years. I was full-time ER for a while. Now I'm part-time ER. And I don't know close to as much as I thought I knew about patient care and about what it takes to become a certified emergency nurse. And so when I was working towards wanting to fly, I became a certified emergency nurse. I became a trauma certified nurse. I became a certified flight nurse. But it was all with the premise of I want to take the best care of patients that I can. I want to be one of the best in the industry. And it wasn't to toot my own horn or anything. It was just to say that if we're playing a sport together, when I was a kid, I was always one of the last people picked, when they're standing there and there's 2 different sides and they're all picking teams of who do you want on your team. I was never the best at sports. And so I was one of the last ones picked. And I kind of made that my thing of if we were going to do this today and pick teams for nursing, I would want to be one of the first people picked. I would want to have the skill set needed. I would want to be able to have the assessment skills needed. And I'd want to have the knowledge and skills to be one of the best nurses on the team. I don't want to be one of the worst. And so I was doing stuff in cardiology still. I was helping out with a lot of very sick critical care transports, both ground and helping with some air transport. And so that's what encouraged me to look into flight nursing. But because I was also working with extremely sick, advanced heart failure patients on mechanical circulatory support, I became an adult ECMO specialist and, balloon pumps and pillows, all this cardiac support stuff. I became interested in getting my critical care certification as well. And so I just feel like anytime you're in an environment and there's a certification for that environment you're working in, it's important that you study it and you become certified because it really helps you with the knowledge needed to care for that patient population. There's a study that goes out, there's a survey that goes out to say of nurses working in this field, whether it's oncology or med surg or whatever, of nurses working in this field, what do they need to know to care for patients in this field? And that's what the certification is built off of. And so I think certification as a whole will make you a better provider. It will show that you have the stamina and the drive to not only work in that environment, but become certified to pass a very rigorous exam. So it tells that employer, hey, this is somebody that really has gone above and beyond working as a staff member in the department and is now an integral part of the department as a provider that is certified, that is working well with others, that wants to advance their education. And with every nursing certification I'm familiar with, there is that need to maintain it. And that takes a lot of continuing education. And so certification is not just a take a test, pass it, you're good to go.
Mm-hmm.
But certification is a commitment to saying, I want to pass a rigorous exam and I want to do a lot of continuing education to maintain that exam that I passed because this field is very important to me. And that's what it entails an employer. That's what it entails coworkers. And, above all, that's what it tells patients. They may or may not know that you're certified, but they can definitely tell that you're a good nurse that cares about what you're doing.
I bet. Yeah, that's very true. Yeah. And it shows a certain commitment. And I think you're backing up what I said earlier about how employers can take notice of such things. And I know there's also clinical ladders and, there's a lot of credit a nurse can get when they have certification, whether it's, being going from, one level to the next level in the organization or getting a raise, there's all sorts of things that can come from that. But speaking of certification, since we're going there, and I know that BCEN is the learning arm and you focus on education and growth of the specialty. So what are the 6 certifications that you all, what would you say, administer?
Yeah. So I would break it into 4 and 2.
Mm-hmm.
So,
okay.
and so BCEN started around the CEN certification. It is our largest. It's the certified emergency nurse. There's also the certified pediatric emergency nurse. Both of those very specific to nurses working in emergency departments. Then there's the CTRN, the CTRN, excuse me. CTRN is the certified transport registered nurse, and the CFRN, which is the certified flight registered nurse.
Mm-hmm.
So the CFRN and the CTRN are both specific to transport nurses and that transport environment. And the reason that I would say 4 and 2 is because we have 2 other certifications, but those are actually more specific to the patient as an individual rather than the nursing environment. So the TCRN is the trauma certified registered nurse, and that's looking at the patient from injury prevention all the way to rehab. And so that TCRN nurse may work in an ER, they may work in a flight environment, they may work in a trauma ICU. It's a nurse that's become trauma certified based on understanding of the trauma process and how it impacts the patient. And then the CBRN is the last and most recent credential. That's the certified burn registered nurse. And that is similar to TCRN. That certified burn nurse may be an ER nurse. They may be a burn ICU nurse. They may work in an outpatient burn clinic and see these individuals 3 months post burn injury. But regardless, it's a nurse working somewhere along that spectrum of burn care.
Wow. So those are all super critical, super important. So I'm glad you elucidated the 4 and the 2, and a lot of respect for people who go through those rigorous processes. Now, I know you all have a podcast that also focuses obviously on emergency nursing. So what's the name of the podcast and what's the aim of it overall?
Yeah, our podcast is called the BCEN and Friends podcast. And what we're looking at doing and the premise behind it is really focusing on the great things that emergency nurses do and the impact that they make and ways that we can be inspired from each other. Now, with that said, we also do interview physicians. We interview others that are not nurses. We've interviewed a number of patients that have been cared for by emergency nurses. But the premise behind it is really to give an idea of the things that emergency nurses are doing. I think when we are working at the bedside and we are very focused clinically at things, sometimes we can lose track of the fact that there's nurses doing really cool things all over. We've talked to nurses doing travel assignments in Antarctica. We've talked to nurses that have done CPR, saved lives on airplanes when they were on vacation. Talked to nurses that are impacting their community. There's a nurse right now that lost their home in flooding in North Carolina. And so being able to see how this impacts them and how they turn a lot of these challenges into triumphs is really important. And that's what we try to highlight on a lot of the episodes at the BCN and Friends podcast.
That's great. So we want people to check that out, BCEN and Friends. So you can find that on Apple and find it on different, you can find it on all the different apps and of course, bcen.org. And Michael, as we wind down, there's just more questions I want to ask you. And one of the ones I want to ask about is artificial intelligence, because you and I had a conversation prior, kind of preparing for this, and we had talked briefly about AI. And we had talked a little bit about nurses kind of thinking that, AI is going to start doing a lot of the work for them. And I'm assuming you probably talk about this in the education you provide, and maybe you even brush up against this in the podcast. So I'm curious, where is AI beginning to fit in to the emergency nursing landscape? Where is it useful? Where do you feel maybe people are seeing it as some like savior that's going to, kind of fix everything or do the work for them? And how do you ride the line between seeing the ways you can rely on it and then the ways in which you should not rely on it?
Yeah, that's a great question. And I think at the very beginning of the question, you alluded to nurses thinking that their jobs are going to be taken or those things. And I wanted to go back to something that we mentioned before the break. And that was, I made a comment that you can blossom in the environment if you want to. And I would say the same happens every day for emergency departments. If you want someone to invest in you, you have to invest in yourself. If you want to succeed, you have to have the drive and the motivation to do that. And if you're afraid that AI is going to take your job, I would focus more on how can I do better at my job and less at worrying about AI taking it. The way that we look at AI today is as a tool. There's certainly robotics and companies out there that have very humanistic looking, developments out there that are trying to do things. But if you look at AI as a tool and how can it be a tool in my tool belt, just like my trauma shears are, just like my IV catheters are, my saline flushes, how can I use AI as a tool? It can be very beneficial. But if you're just constantly afraid of AI because maybe you don't understand it or because you think it's going to take your job, then I would encourage people to really take more accountability for their career and invest in themselves some more and see how can I push myself above what I feel AI is capable of doing. But what we see AI with in the emergency setting in particular is there are more and more trauma centers that have video cameras in trauma bays, and that's to help with process improvement, quality improvement, and those things. And they're able to use software AI to track movement, to track times, to see how people respond in certain situations, or maybe even understand when medications were administered in these things. It's not for a punitive reason. It's really just to say, how can we do better? How can we go become a very cohesive team? We also see AI used in the triage area. And so based on what an individual says when they come into triage, that is input in the computer, and AI can then help determine what that acuity level should be or how quickly we need resources for that individual. And so again, it can be a tool that's helpful. Is it perfect? No, but your trauma shears aren't always the right tool for things either. They're not always perfect either. And so using it in the correct way is important. AI is also being talked a lot about in the test development world. And so, how can we use AI to help with exam creation and test question creation and these things? And there's a lot of specifics and questions still in it. Um, but if it can help expedite processes, if it can help find references and resources, if it can lead to very clinically accurate stuff that is then reviewed by humans that are experts in that field, it can be a tool that's very helpful. And so I think I think where AI gets a bad rap is that people just don't have an understanding of it. And AI is also a very large term. And so you can talk about advanced language learning, you can talk about robotics, or you can talk about a VR headset. And in that, those are three very different things. But in that conversation, the term AI will come up because people think it's artificial intelligence. Um, but virtual reality is actually becoming a much more popular way of training people. Nursing schools are using VR headsets a lot. There's companies out there that are making very realistic sim environments for emergency patients and allowing you to interact, allowing you to assess. You get to hear breath sounds on an individual that you may not hear those breath sounds very often on, or a patient that has a S3 or S4 heart tone that you may not really hear much in the clinical setting. Now you can hear it instantly based on a scenario. And so being able to use these tools, being able to adapt them to the emergency environment, I think has created major improvements in the education we provide for new nurses. But to lump it all into this one topic of AI and to instantly be scared of it, I think is counterproductive for the field of nursing. And I think if we embrace it a little bit more and understand that AI is a very large term that encompasses a lot of different things, and how can those things be used for good, and where would they be harmful for a nurse? How could wearing a VR headset actually hurt in the actual clinical practice environment? Those conversations definitely need to happen. But AI is certainly providing a lot of opportunities that many don't have. And you had mentioned before about a nurse residency program, and you feel like every nurse should have one. And I don't disagree with that. But there's also a lot of very small hospitals. And I think that most people working in a larger facility or larger hospitals may forget about that. But I've spoken with a nurse at one hospital. It was literally just him and one provider that was a per diem physician in a 3-bed ER.
Wow.
In a very remote location, and they had 3 people come in with gunshot wounds one night. Well, that ER is 100% government funded. They don't have a large health system overseeing them. And so to be able to have the tools to go online and get education for that single nurse, or to be able to put on a VR headset that costs a few $100s and have access to very high quality education at their fingertips is something that many of those very small, very rural, even frontier, what we would consider a frontier hospital, which is extremely rural, to be able to have access to that is a very cool opportunity that doesn't mean you have to work for a major healthcare corporation to be able to have those kind of tools.
Wow. Very well said. Thanks for encapsulating all of that and kind of laying it all out in a very thoughtful way and very intelligent way. So it's not something to be afraid of. It's something to embrace, and it's something that we can learn to use. We don't want to lose our assessment skills by relying overly on AI, because we need those physical assessment skills. We don't want to lose that, but we also want to take advantage of the tools because they're there and they are going to get better. They're all going to become sharper and smarter, and we can leverage them to our advantage. And I think that's what you're getting at, that we can leverage them any way we would like. And I think as healthcare providers too, we have the responsibility to give feedback when we feel like one of these systems or one of these ways of operating aren't working. If your facility starts to utilize a tool that you feel like isn't quite accurate or isn't providing what it is supposed to or purports to, that you need to speak up as well. So I think these are points that are really well taken. And, before we go, I wanted to ask you one more question as we wind down. And that's, what is your, if you could choose just very briefly what your vision is for what you would like to see, let's say in the next, I don't know, 10 years, what would be your most optimal vision for how your specialty evolves in the next decade?
Oh, well, that's a very good question. When I took on this role at BCEN, the learning environment was very new to us. We had just started this whole other arm, and I was I didn't want to see education just become read this, sign this, have a good day. Now you know. I wanted it to be something that was tangible and that stuck. And that's what we've really tried to do with the BCN platform, the BCN Learn platform. Um, I don't know if we have talked about it, but we have over 100 courses now. We have a lot of webinars. And I could talk about BCN Learn and the strides we've made there all day long. But the whole thought behind it is we want to do things well. We don't want to just do something because we're checking off a list that says you need to do this. We all have tasks we have to do. We have to brush our teeth every day. We have to eat something every day. Those are things we have to do because we've learned our whole lives that it's important to do. But when we do things, we want to do them well, and we want to do nursing care well. We want to do nursing education well. And I think where I would like to see the industry go, whether it's working as a staff nurse in the ER, whether it's a manager, whether it's in the education realm of emergency nursing, it's always very valuable to me to find other people that want to do things well and that have a real passion for advancing the profession. And that's the thing that I really enjoy about working at BCEN is you have a lot of certified nurses or nurses that want to become certified that are really passionate about advancing the profession and advancing themselves. So it's given me a great opportunity to meet people with very similar interests that are very in tune with what's happening in the industry and want to see it get better. And I think, we can certainly focus on many areas of government advocacy, local advocacy. We could talk about, things that we need to do better as individuals with learning. But somebody told me a long time ago that he had come to me and he'd offered me a job. And I said, why are you offering me this job of everybody else? I don't know. I appreciate it, but why me? I said, don't you want to interview a few people? Don't you want to ask a few people, get some other ones in the mix? And he told me something that's always stuck. He said, every day is an interview. And I've watched you for years and you've been interviewing every day and you just didn't know it. Yeah. And I think about that all the time. And it might be a patient care environment. It might be at the bedside. You're interviewing literally every day, everything you do, whether you're a manager and you're talking with somebody on the staff, whether you're standing in front of a projector screen educating a group of nurses, or whether you're just walking into work and you pick up some trash on the ground. Every day is an interview. And I think that people sometimes lose sight of that. They think that every day is a day to get a paycheck, or they think that every day they're just going to hope they survive a 12-hour shift or whatever. And it's unfortunate that people feel that way because there is so much opportunity in in nursing in general, really, but in emergency nursing, there's a major opportunity to make an impact on somebody's life at their absolute worst day. And there's certainly people that come in for primary care, and unfortunately, some of them don't have another choice. They kind of have to come in if that's what they need, whether it's their insurance status or whether it's that they haven't got set up with a new primary care doctor yet. Whatever it is, I don't care. I don't judge them. I just see them and take care of them. But for the ones that are truly having an emergent, life-threatening, needs to be treated immediately condition, we certainly don't want to be not on our A game because we are so frustrated with the other things happening around us. We want to be on our A game every single day. And I think understanding that every day is an interview and that there's a lot we can do to impact change. There's a lot we can do to improve ourselves as individuals and improve the profession. And so when you ask, where do I want to see things in 10 years? I would love to see all of these nurses that I'm interacting with on a nearly daily basis having that similar mindset of saying, we're going to advance ourselves, we're going to improve this profession, we're going to improve patient care, and we're going to do it in a way where we take more accountability, more autonomy for the things that we see. It's easy to point fingers and say, that nurse Keith should have done this or that, but it's a lot harder for us to get up and go be the change agent that we want to see. And emergency nurses have the skill set to do that because they've been taught to think on their feet. They've been taught to be very proactive. And so they can certainly be that kind of individual to be the change agent. And I would think and hope that in 10 years' time that more and more people will realize that. And they'll realize that every day is an interview and that they need to be the individual to take accountability.
Wow. Well said. Gosh, that was a mic drop moment if there ever was one. Thank you, Michael. Gosh, there's so much more we could talk about, but we do have to go. And I have 4 really quick lightning round questions to ask you that I ask all my guests at the end of interviews. Are you game for a quick lightning round?
Yeah, absolutely.
Okay, so these have to be kind of concise. So the first question is, how do you define success? What does success mean to you?
To me, success is defined by relationships. I would think that somebody could be a multimillionaire, multi-billionaire, and if they've ruined and destroyed everybody to climb to the top of that ladder that they think they need to be at the top of, then that's not success. I think success is really defined by the people around you. And I have done things that a lot of people, feel like are a huge accomplishment, and they certainly are. For me, it's always about pushing myself. And so I hold multiple certifications. I was recently awarded a Brandon Hall Gold Medal Leadership Award, and those are great things, and I really appreciate it. And it takes a lot of time and effort to do. But at the end of the day, if I was to do all this stuff and my family life was destroyed and I had no friends, I wouldn't be a successful person. And I think at the end of the day, the people you surround yourself with define success for you. And I feel like I'm extremely successful with that.
Thank you. Okay. Second question. Could you name one person who has been a big inspiration to you in your life? They could be living or dead, a really famous person, or just someone from your personal life who you would just like to name and call out as special.
Well, I'm sure that you've had this answer a lot, that there's certainly hard to say one. And I could definitely give you quite a few examples, but I'll tell you one individual that I distinctly remember whose name I don't even know. And that was a patient that I cared for. And I was newer in the cardiology area, and she came in for a carotid endarterectomy, just to visualize the carotid arteries. And we talked for a long time. And I remember thinking at the time, I didn't get this opportunity in the ER to just sit down and talk to somebody, and how nice it is. And this lady is so sweet. And she just told me how she was a Walmart greeter and she enjoyed her job and it was the best thing she'd ever done. And she loved people. And we just connected really well. And she had severe carotid stenosis and she needed an open surgical procedure to fix that. She had the procedure and she had a major complication, major stroke, and she died. And I remember thinking at that time that life is very fragile. And in the ER setting and in the EMS setting, I would pick up patients that were already coding, or, you certainly deal with the fragility of life, but to sit down with somebody and talk to them about their dreams, their aspirations, their wishes, and then a few days later, those are completely gone. It really brought the aspect of the humanistic element of nursing back to me in a way that the ER didn't. And I think it really taught me to treat people better, to treat people differently, and made me rethink, what is nursing really about?
Yeah. Wow. Great story. Thank you for sharing that one. Wow. It's beautiful. Okay. Third question. Is there a book, a movie, anything in the wider popular culture that's had an impact on the way you live your life, the way you parent, the way you conduct your relationships, anything at all? Is there one that you would like to name?
Um, there's a few. I would say
Mm-hmm.
the one that I've probably named the most,
Mm-hmm.
um, outside of any religious type material, because
Mm-hmm.
that is important to me. But
Mm-hmm.
the one that I have probably recommended the most to people is Sun Tzu's The Art of War.
Oh yeah.
Believe it or not, not
Another
because I am
guest
a
mentioned that recently. So
okay.
yeah, go
Yeah,
ahead.
not because I'm a proponent of war, just
No.
because there's a lot of really good lessons about leadership and management in there,
Mm-hmm.
and it's from a different perspective.
Yeah. Yeah. You're the second person to bring up that book. I read it many years ago. So thank you. Okay. Last question. If you were named king of the world tomorrow and you had ultimate power, you could do everything, what would be your first act as king to improve the lives of your subjects? Just your first act. What would you want to do?
King of the world.
Yeah.
Wow,
You could do everything, anything.
this is a tough question.
Hmm.
Um, to improve the lives of every person in the world.
Yeah.
Wow, you are asking a tough question.
Hmm.
Let me think about this for just a second. I think I think there's a lot of truth to the hierarchy of needs and food, water, shelter, those things. And
Mm-hmm.
um, I think there's still quite a few people that don't have access to good food, water, and shelter. And I
Yeah.
think if I was going to immediately try to improve everyone in the world, I would
Mm-hmm.
probably start at that level and make an initiative that we are going to improve access to that immediately.
That's a good one. Go back to Maslow. You can't go wrong, right? Go back to the hierarchy of needs. Yeah, to be a great place to start. Well, Michael, I appreciate you being here so much. You're the director of professional development at BCEN, and people can go to bcen.org to check out all the certifications and all the webinars and education that you all offer. And, there's a lot there. It's very rich. There's lots for people to explore. And of course, they can go to BCEN and Friends, the podcast. They can check that out on Apple and all the places where we find podcasts. And thank you so much for being here. Thanks for your wisdom and your really wonderful erudite answers. And thanks for being here and gracing the airwaves and sharing all your perspectives. I really appreciate it. And thanks for supporting ER nurses all around the country.
Yeah, absolutely. It's been really great chatting with you and answering the questions, and hopefully we can see that 10-year growth like you talked about, and see a lot of people across the nursing world really take hold of their profession and advocate for themselves and be accountable, and realize that there's a lot that we can do as individuals if we just take a moment to look beyond the daily tasks that we get enamored with.
Oh, I hope so. Thank you so much. Well, thanks for being here. Thanks for listening to this episode of the Nurse Keith Show. And remember, head over to bcen.org if you want to check out the Board for Certification of Emergency Nursing. The show notes are at nursekeith.com and on the app where you're listening. If you need holistic career coaching, please check out nursekeith.com and Nurse Keith Coaching. Mention the show and get 10% off your first coaching package. And head over to healthpodcastnetwork.com to check out all the shows. We are members of the Health Podcast Network, and we are adroitly produced by the inimitable Rob Johnston of 520R Podcasting. And before we say goodbye, I'll leave you with this quote by Helen Keller. The best and most beautiful things in the world cannot be seen or even touched. They must be felt with the heart. Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and Michael Dexter bidding you adieu from
Minden, Louisiana.
All right. Thank you, Michael. Thanks to everyone for listening, and we'll catch you on the proverbial flip side.